timeline is limited, many high-risk women start to ponder whether or not they want to choose to have children. I will say most women I talk to do still continue with plans to get pregnant, but they might choose to move their timeline up and have a child earlier than planned, so they can plan to have that surgery in their later 30s. It also makes them consider if they want to have their children spaced more closely together. So if they want to have 2 or 3 kids, they can have those kids before they have surgery, or they might choose to have fewer children than originally planned if they don't want to delay surgery. So although finding out you're at high risk can throw a wrench into your family planning, the good news is that there are several great options to consider, and even if you're not ready to have kids anytime soon, you can increase your options for the future if you start to think about it now. On the next slide, it shows, we go through some reproductive options where science has taken us and given us these options. So if you work with a fertility doctor, they have helped women with a functioning uterus achieve pregnancies even if they don't have their ovaries. And before having an oophorectomy, women can choose to have in vitro fertilization and bank embryos so they can become pregnant at a later date. To bank embryos, you do need to have a partner or a donor to fertilize those eggs, but egg banking is also possible for women who don't have a partner. Now, while these are available, it is important to note that these are not always 100% successful. So it's important to talk to fertility specialists about these options before deciding what's best for you. People who have a genetic mutation and are concerned about passing it on to their offspring also have pre-implantation genetic diagnosis as an option. And this applies to both men and women who have a genetic mutation. Essentially, a couple would undergo IVF,